Dr. Anupam Sibal, who is our senior consultant in pediatric department and a group medical director of Apollo Hospitals Group, to deliver his welcome note. Over to you, Dr. Sibal.
Good afternoon, friends. It's indeed a privilege for me to be able to join you virtually, and it is in keeping with the times that we are meeting virtually. All of you are distinguished experts in pathology. You understand the intricacies and complexity of medicine so well, so it's indeed a privilege to be with you today. COVID has turned the world upside down, so let's pause and look back. E-commerce saw 10 years worth of growth in 3 months. Netflix added 16 million subscribers in 5 months. Disney doubled to 50 million. Zoom went from 10 million to 200 million in 3 months. Remote learning grew by 120%. There was a decline in print media by 33%. Basically, we are going digital, our lives are going digital, and no aspect of our life will be untouched. Digitalization of health, which started years ago, has now gained momentum. AI and ML are not just words now. We at Apollo looked at 400,000 records, worked with Microsoft and created a cardiac risk score that's being used in the country and overseas. Today, by looking at an image on a phone, we can decide whether a stroke patient needs thrombolysis or not. We're able to report chest x-rays using machine learning without a radiologist. The COVID risk scan that we developed saw 15 million downloads. Basically, COVID has shown that we need to use technology to offset the deficiencies that we have in specialists. For example, managing ICUs. And during COVID, we managed our eICU platform to manage several hundred beds across 8 states of the country. Apollo Radiology International now reports up to 1,000 reports a day with a turnaround time of 1 hour across the length and breadth of the country and overseas. Teleophthalmology touched more than 1 million lives and provided 900,000 spectacles in Andhra Pradesh. Similar examples through our electronic urban health center program, examples of e-Aushadhi in Jharkhand, examples of telemedicine in Uttar Pradesh, in Himachal Pradesh at 12,000 feet. In Kaza and Kelong, we've touched 35,000 lives. Ask Apollo now has touched patients in 48 countries. Apollo 24/7 is growing. So what is happening in different medical and surgical specialties? It's only appropriate that digitalization becomes the norm in pathology. The most critical of all specialties, we as clinicians are indebted to pathologists for giving us the opportunity to offer the best possible treatment, which wouldn't be possible without your expertise. Now, I'm a pediatric gastroenterologist, and it's only with the advice of our pathology colleagues can I put a child on a gluten-free diet if I see celiac disease on a biopsy, a child on monoclonal antibodies for chronic diarrhea if he has IBD, offer a baby with neonatal cholestasis a Kasai's photoenterostomy based on what you show in a liver biopsy, a baby with liver failure and liver transplant based on the evidence that you show in terms of cirrhosis, and IV methylprednisolone to a child who develops acute cellular rejection after a liver transplant. Digital pathology has really come of age. There have been rapid advancements, and I think the advantages are numerous. Improved analysis, reduced errors, faster turnaround time, better workflow. It can help in prioritizing for trials. AI and ML will help a pathologist sort their work out by deciding which biopsies need to be reported earlier. The clinical impact is going to be huge. For us at Apollo, the fact that there are subspecialists in the 13 recognized subspecialties of pathology is huge. So if you want a biopsy on someone who specializes in neuro pathology, we're going to get that. Someone who specializes in renal pathology, we're going to get that opinion. When I just want to take you back, when we were training, a patient underwent a cholecystectomy, which was open, and stayed in hospital for 7 days. Today, with laparoscopy, they go home in 24 hours. If we look back, many clinicians resisted change, and they said, no, nothing like open cholecystectomy. But can you identify anyone today who has a routine cholecystectomy open? It's all laparoscopy. The same is happening with robotics. So I'd urge our colleagues in pathology to embrace digital pathology and do that with open arms. Because believe you me, if there's going to be hesitation, our patients are going to make that hesitation go away. Digital pathology is going to be transformative, and I'm pretty sure that the session today is really going to open our eyes to the numerous possibilities that digital pathology brings to our table every day. Thank you so much.
Thank you so much, Dr. Sehbal. That was a very nice introduction, welcome note for us. Okay.